just a little background about Fighting Blindness. Fighting blindness, this is our vision. Okay, so our vision is to cure blindness, so we're ambitious, to support those who are living with sight loss, ensuring those, as we call them, back at the ranch are getting the best care from a psychological perspective, and also to empower patients to be effective and educated actors in all that involves them in the development of healthcare. So just cure, just to let you know that we started as a bunch of families in 1983 that were diagnosed with rare forms of sight loss, genetically inherited forms. The families got together in the Eye and Ear Hospital in Dublin, and they really just helped each other to come to terms with what is a fairly significant diagnosis. You're told essentially that you are going to lose your eyesight. We don't know exactly how long that's going to take you. Because it's a genetic disease, if it's not in your family already, it may be in other members, and it may be into the future. And then there would have been people who would have been diagnosed with the dominant forms of the conditions. They would have been more familiar with it. So people coming from different perspectives. What we did know was that there was absolutely no hope for a cure, and very little known at the time about genetics. These are conditions that affect many families in Ireland. So the genetic and inherited diseases, we reckon there are about 5,000 people in Ireland affected. So what we did was we raised in Ireland at the time, a very lovely man, God rest his soul, Paddy Byrne, worked in the Irish Independent and forced all of his colleagues to buy raffle tickets for €100 a pop back in pounds, I should say. Back in 1983, we raised €150,000 in today's money, and set about establishing a project in Trinity College to look at the course of a condition called retinitis pigmentosa in Irish families. We in fact were the first group in the world to discover the gene responsible for retinitis pigmentosa, the rhodopsin gene, and I'm very happy to say that we have moved that project now out of research into development, and we hope that it will go towards the development of a treatment for people living with the dominant form of inherited RP. So we have, through our work now, become global leaders in the search for cures and treatments for genetically inherited, but also age-related forms of blindness, because as we started to fund research, and we funded 40 projects up to now, €15 million we've invested, which we've fundraised for, we started to learn more about common causes of blindness, particularly in the retina, age-related macular degeneration, which affects 1 in 10 people over the age of 50, and also diabetic retinopathies. And we learned that some of the research that we had been doing could be applied to learning more about these conditions. So that's how we evolved. And as I said, now we're global leaders in this area. So we provide support, as I said. We started our Inside Counselling service back in 2002. We've just recently located it to our offices in Eli Place, and we're developing a centre of expertise there in how we can really intervene and provide people who are looking into a future of darkness, really. We can bring them together and really hope that we can develop the therapies, but while we're waiting for them, provide them with the best care psychologically. So we do couple and family therapy support, peer support, telephone counselling. We've also got weekly support groups in the Eye and Ear and the Matter, and we do outreach to patient groups. We also work now, thankfully, in Cork and in Limerick, and we're going to be branching into Galway soon. So we're very excited about this because we think this is incredibly important to break the isolation that often sight loss brings. But what I really wanted to talk to you about today in this context is empowerment. We believe that there should be nothing about us without us. Many of you will have seen this statement, and it's something that we adhere to. A central goal of Fighting Blindness is to collaborate with like-minded organisations and individuals who share our goals. And we work nationally, and we've worked with IPOSI, we've worked with the Genetic and Rare Disorders Organisation, Medical Research Charities Group over the years to look at how we can advocate for better care for our patients, because we do believe in a collective voice. But in doing so, we also work internationally, and I think a lot of us will know, particularly in the area of therapeutic development, that is incredibly important to work at a European level. And there's great examples there of where the patient voice is central to the decision making that is involved in healthcare and the development of therapies also. So, as I say, we work to empower patients through education, knowledge, experience, collaboration, and the collective voice to enable our common goal. So these are the facts that we in Fighting Blindness are dealing with. So worldwide, there's 45 million people who are seriously affected by sight loss. There will be 55 million by 2020, we reckon. In Ireland, we have 224,000 people affected by sight loss. Now, that's a very significant constituency of people, and we know that that's going to raise, because of our ageing population primarily, by 2020 to about 272,000 people. And what we also know is that 75% of blindness is avoidable. Now, this is a huge issue for an organisation like Fighting Blindness, run by people who are affected by sight loss. We as patients find this absolutely abhorrent. We have to do something about it. We have to raise awareness, because if something like this condition is avoidable, we need to do everything we can to make sure that it is so. So what can we do as a small patient-led organisation with a small resource, small staff, small budget, work to reach out, not only nationally, but also, internationally. So how do we do that? What we believe strongly in is engaging, as I've said, with like-minded individuals. So who are they? We work with other patient groups who have a similar objective. We work with healthcare providers. We work with allied health professionals and associated professional bodies. And we also work with industry. Okay, so here is one of the conditions that I wanted to talk about. Diabetic retinopathy. This is a very significant condition, as we all know, and we must promote the fact that now we have a screening program where we can maybe pick up at an earlier stage people who have diabetic retinopathy and intervene as quickly as possible to limit the effects of the sight loss. And for those of you in the audience who can see, it's a very, it's a condition that really limits vision, and it does affect people of all ages and people of both sexes. And I'm saying that because I have some anecdotal information in my head, but it's probably best not to say it because it actually is anecdotal. So you might correct me. But it's a very interesting, it's very good that we have a screening program, but how do we advocate and how do we ensure that people are aware of it? So what we did last year is we worked with an industry partner, Novartis, to establish an awareness campaign on DME. It was a multi-stakeholder campaign, and we involved all our patient groups like the National Council of the Blind, also the Diabetes Federation got involved, healthcare professionals through the ICO, optometrists, to really push the agenda forward. We got a lot of media coverage, a lot of education about how lifestyle can contribute to the national how lifestyle can contribute to developing diabetes in the first place, and we really wanted to promote the screening program. So actually the whole thing was about healthy recipes. It was all about how you can look at what you're putting into your food and how that can really help you, in your lifestyle. So that was the particular focus of that campaign. The other campaign that we're particularly concerned about, the other condition, is age-related macular degeneration. And now macular degeneration, as I said already, affects 1 in 10 people over the age of 50. It often manifests itself in one eye and then can develop into the other eye. We have a significant amount of people in this country who are affected by age-related macular degeneration, but we know, again, like DME, like diabetic retinopathy, if we change our lifestyle and we understand it better, and we go and get our eyes tested, which, believe it or not, is one of the last things people decide to do when they're deciding their care for the year. They'll go to the dentist maybe, but rarely will people go to the optician or even the ophthalmologist. So we're trying to raise awareness and get people out there not to be scared, because the reality is, the earlier you have an intervention, the better. And so AMD Week, AMD Awareness Week, has actually been ongoing since 2001. And over the years, we've built up partners in this field. And we, again, the patient groups that we work with, again, healthcare professionals, the Irish College of Ophthalmologists, Association of Ophthalmologists in Ireland, and we work also with Novartis in this campaign. And the campaign runs every September. It's a week-long event. We get a lot of media coverage. We have mobile testing units around the country, so we can pick up people at an early stage. And you get some really good information as well about demographics, and you know, it's really, really a good campaign. But what was really great about this campaign this year was, you know, we talked about healthy living and lifestyle choices, and I think in all of our organisations we do talk a lot about lifestyle choices, and maybe the public is a little bit, you know, done with that. Maybe they already know. Maybe there's other ways of getting the information across. So we put together a little booklet, and it was called Change Your Next Chapter. So how you change your next chapter. This little booklet here, I've just brought it. It's actually Begin Your New Chapter. And what we did is we got Irish authors to look at classic stories, like for example Jane Eyre, Pride and Prejudice, these types of stories that many of you will know and have learned in school, and change the ending. And it was actually very, very interesting, because we as patients, in a lot of cases, can change our ending and can change our outcomes, I should say, and how things will work for us, and that's very important. So we were very happy with this campaign, and we hope that we can go ahead and keep running this as long as we need to, because information is getting out there, but it's not getting out there as quickly as we would like. So then we also, in Fighting Blindness, we have another issue insofar as that we're dealing with very rare inherited diseases. And as I said earlier, when you think about the research that we're doing, we're talking about genetic diseases. And what we need to do is we need to find a lot of patients who, in the early days of healthcare, maybe 30 years ago, 20 years ago, when they were diagnosed with a condition that had no hope of a treatment or a cure, they didn't come back into the healthcare system. So we need to find those patients, because we need to ensure that they're genetically profiled and that their information, should they wish it to be, is stored in a national register, so that when clinical trials develop, and they are developing and they're happening right now, we will know the patients that will be able to access those particular clinical trials. Because what we have discovered since our inception in 1983 and us learning about the first gene for retinitis pigmentosa in 1989 is that now there's about 200 different genes for retinitis pigmentosa. It is one of the most complex genetic diseases that exists. So that's why it's really imperative for us to understand more about them and ensure that the patients out there understand more. And how will they understand more? Only through the professional bodies like the Irish College of Ophthalmologists, when they go to see their ophthalmologist, when they go to see their optician. So what we wanted to do is create a booklet. Well, initially we thought it would be a booklet. It grew a little bit into quite a solid piece of publication. And this lists as many as we could of the more common, if you like, rare forms of retinal degeneration. It also details diabetic retinopathies and age-related macular degenerations. So patients are given this information. They hear about other people's experiences of dealing with the conditions in the past and in the present. They hear about the psychotherapy services that are available to them, the social services that are available to them. And this project was supported by Bayer. And to be honest, we just could never do something like this as Fighting Blindness, a very small organisation. And I can tell you, as a person who was diagnosed with retinitis pigmentosa at 23 years of age, my family and I could really have done with this. And to have this now is really important. And it's flying out the doors, it's going into the eye clinics, and it's a very, very useful tool. And so that's really our experience with working with industry. It's very much a partnership of equals. It's a partnership of collaboration. It's a very creative partnership, and it's one that we appreciate and we have built up over many years. And as you said, Oliver, I think earlier, you do need to build these relationships over the years, but it's also fantastic to bring in other patient organisations, other charitable organisations, other service users, to ensure that we reach as many people as possible, so that we can be looking at figures into the future that are much less, that 272,000 people in Ireland affected by sight loss will diminish, and we'll have a bright future for everybody. So thank you very much.